Assalamu alaikum students. I'm Dr. Irum Qureshi. I welcome you all, and today the topic of our tutorial is primary health care. As you already know that there are three levels of health care known as primary, secondary and tertiary health care. Health system of Pakistan is divided into public and private sectors. Public sector has four tiers. Number one is the outreach and community-based services, which focus on immunization, sanitation, malaria control, maternal and child health, and family planning. Number two tier is primary care facilities, which include basic health units and rural health centers, and they are focused on preventive and outpatient, inpatient care. Third tier of public sector is secondary care facilities, which include tehsil and district headquarter hospitals, and they provide outpatient, inpatient, and also specialized care. Fourth tier is tertiary healthcare facilities. These include hospitals, which are mainly located in major cities, and they provide more specialized inpatient care like Punjab Institute of Cardiology, institutes for kidney and liver transplants, etc. Okay, now in this figure you can see Pakistan's healthcare system, which starts with primary health care, which is provided at basic health units and rural health centers. Secondary health care includes tehsil hospitals, district hospitals, while specialized inpatient care is provided at tertiary care hospitals. This figure represents statistics regarding health system in Pakistan. The new concept of primary health care came into limelight in 1978 following an international conference in Almaty, USSR, and main goal of governments and World Health Organization in the coming decades should be the attainment by all people of the world by the year 2000 a level of health that would permit them to lead a socially and economically productive life. Primary health care is defined as essential health care based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and the country can afford to maintain at every stage of their development in the spirit of self-determination. Primary health care is the first level of contact between the individual and the health system where essential health care is provided. This level of care is closest to the people. This level, secondary health care, serves as the first referral level in the health system. At this level, more complex problems are dealt with, and this care comprises essentially curative services and is provided by the district hospitals and tehsil headquarter hospitals. While tertiary health care offers super specialist care, this care is provided by the regional or central level institutions. They provide not only highly specialized care but also planning and managerial skills and teaching for specialized staff. There are 5 basic principles of primary health care. Number 1 is equity, which refers to equal access of healthcare facilities according to the need of people and equal utilization of healthcare according to their needs. It should be appropriate as well as accessible, affordable, and effective, efficient. Number 2 is appropriate technology. Technology refers to the combination of skilled personnel and other resources, including equipment, such as the set of techniques include drugs, materials, procedures used by healthcare professionals in delivering healthcare to the individual. Number three is community participation, in which specific groups of people with shared needs living in a defined geographic area actively identify their needs, make decisions, and establish mechanisms to meet these needs. Number fourth is intersectoral coordination, which means that different sectors or departments of the government are interlinked with health sector, like environmental department. Number five is decentralization, which means the transfer of authority to make policies and decisions to carry out management functions and resources from central government to local government authorities. There are eight basic elements or components of primary healthcare. It is very important from examination point of view. Principles and components of primary healthcare are very important, and it includes number one, education about prevailing health problems and methods of preventing and controlling them. Second component of primary health care is promotion of food supply and proper nutrition. Third is adequate supply of safe water and basic sanitation. Fourth is maternal and child health care, including family planning. Fifth is immunization against infectious diseases. Sixth is prevention and control of locally endemic diseases. Next is the appropriate treatment of common diseases and injuries, provision of essential drugs, and promotion of mental health. As I have already mentioned that primary health care in Pakistan is being provided at basic health units and rural health centers. Basic health unit serves 5,000 to 10,000 population. Services provided at this unit include maternal and child health services, child spacing, malaria control, immunization, diarrheal disease control, mental health, and school health services. Outreach services are provided primarily for maternal and child health care through training birth attendants and lady health workers, which are in turn supervised by lady health visitor. 5 to 10 basic health units are linked to a rural health center. Each rural health center has about 25 beds, a laboratory, X-ray, and provision for minor surgery. RHC is linked through the Tehsil Hospital, which in turn is linked to District Headquarter Hospital, and District Headquarter Hospital have all medical facilities. The whole system of BHUs, RHCs, Tehsil Hospital, and finally District Hospital is designated as Integrated Rural Health Complex. All the BHUs are staffed by medical officers, a male and female health technician, support personnel, which include medical technician, lady health visitor, LHV, lady health workers, and etc. Rural Health Center provides a pivotal role and acts as a focal point in the health system, and it is provided with dentist, a microscopist, and a sanitary inspector. This type of approach removes disparity in urban and rural areas in times to come. There are two approaches for provision of primary health care. One is selective and other is comprehensive. Selective primary health care is a policy to deal with most serious health problems, while comprehensive health care is too costly and requires a large number of trained persons. UNICEF proposed a selective approach with emphasis on mother and child health according to Gobi app, which indicates G is for growth monitoring, O for oral rehydration salt, B is for breastfeeding, I is for immunization, F is for family planning, female education, and female nutrition. The functions of primary health care include selective and comprehensive continuous care to the patients, referral to specialized hospitals, to coordinate policies for the patient, to guide the patient within the network of social welfare and public health services, and to provide the best possible health and social services in the light of economic conditions. As far as problems in Pakistan's health system are concerned, our health system is inadequate and underfunded, and it is focused mainly on urban areas. With rapid population growth, the facilities are not expanding proportionally. Our major problems are inadequate funding, lack of health facilities in rural areas, unemployed doctors, acute shortage of doctors and trained medical personnel, brain drain of medical graduates, increasing prices of medicines and inflation, circulation of fake medicines, and corruption. Pakistan spends less than 1% of its GDP, which is gross domestic product, on health sector, which is one of the lowest in the world, which results in limited allocation of funds for personnel, equipment, and other resources in health sector. Our major health system issues are critical shortage of health service providers, our weak regulatory framework, and corruption. There is political interference in transfers and postings of medical staff, and there is lack of political commitment. There are other health system issues like lack of funds, lack of multifaceted approach, as environmental degradation arising as a result of scanty rainfall, agriculture crop failure, deforestation, soil erosion, and as well as poverty and illiteracy should be considered as health-related components. Now, there are also equity issues as there is 70% population living in rural areas, but most of the medical personnel and health facilities are found in cities. Approximately 85% of practicing doctors work in cities. All urban inhabitants don't have equal access to healthcare. Those with money can afford and get the best technology and have immediate access to facilities. There is extreme disparities in wealth, income, power, and status. There is also male dominance and gender discrimination, social injustice, and caste system. There is also lack of public sector credibility and capacity building of public health personnel.